This is our second time, and we returned here because we had so much improvements after the first treatment. He seemed to understand much more about the social situations. And then slowly, day by day, weeks by weeks, he started to speak more, to build sentences. Every one of us and every one of them, I mean therapists, so school teachers, noticed a big difference. And they started to notice that he was present, totally present to every activity, totally interested. We were also surprised as parents because, you know, for a parent it's also really hard to understand. And she told us, the teacher told us, he can read. He can write. She showed us some videos of the activities, and I remember we cried.
So good afternoon. Thank you so much for letting us ask you a couple of questions, as it is your second visit. Would you please tell our viewers where you come from and what brought you to Swiss Medica? Why are you here?
I'm from Italy, and we chose the Swiss Medica to try stem cell treatments. This is our second time, and we returned here at the Swiss Medica because we had so much improvements after the first treatment. And my son had speech, behavioral, and comprehension improvements. And after the first treatment, he started to build complex sentences, to read, to write fluently, to count, to make some addiction. So math addiction.
Yes.
And we are really satisfied with this treatment.
When you came back home, how was his behavior changing? What were the first signs that you started as a mother to notice?
After 2 or 3 weeks, he were more comfortable with the environment. He was quieter, and he seemed to understand much more about the social situations. And he started to interact full with the environment. And then slowly, day by day, weeks by weeks, he started to speak more, to build sentences. Before the treatment, he could just say separate words to ask something. He started to interact, full interact, looking in the eye, always respond when we call his name. What can I say? He started to be really present.
Present.
Really present.
I see. I can imagine what a relief it is for a mother.
Yeah.
And what a big victory, yeah? Some small things that make big changes for you as a parent, right? And for him,
it was possible to travel together, to have fun together, to plan something together. So that was a life changer for us.
We are really glad to hear that. It is not only your son's victory, it is also our victory, our small, big victory. While you were at home these last 2 years, what kind of therapies you also had with him? It's not like you also did the stem cell therapy and you were hoping for a miracle. You were probably doing something, some speech therapy.
Yes, he had already, before the first treatment, he got the behavioral therapy.
I see.
The speech therapy, and then we simply continued with it. But the change he had was because of the stem cell. Of course, we continued and we are continuing to work on every level. So at school, at home, with the therapist. But every one of us and every one of them, I mean therapists, so school teachers, noticed a big difference. So for this reason, we are here for the second time.
Who was the first one to tell you that something is, or did the teachers know that you were going for stem cell therapy?
Yeah.
Were they expecting some changes, teachers?
We had the first treatment in the end of March, so 2023, 2 years ago.
Yeah.
So the school in Italy finishes in June. So we have a big stop, 3-month stop in June.
Okay.
And then he had a summer camp, like a summer camp with other kids and therapists and so on. And they started to notice that he was present, totally present to every activity, totally interested. And then in September started the school again, and the teacher was totally surprised. We were also surprised as parents because, you know, for a parent it's also really hard to understand the real potential in certain areas, yeah. And she told us, the teacher told us, he can read, he can write. She showed us some videos of the activities, and I remember we cried. Yeah.
Right now, what kind of aspects of his everyday activity you would like to improve after this second treatment?
We'd like to improve the aspect of his capacity of weight. So turn, placing turns. We expect a little bit more speech improvement in speaking because the quality of the speech is not so fluid. So he speaks,
the vocabulary is not rich enough yet.
It's rich,
maybe,
but he tends to use always the same words.
Same phrases.
He understands a lot.
I see.
He can express everything he wants, and he can also tell about the activities he had during the days and what he wants to do the day after and so on. But the vocabulary he uses is a little bit limited. So we expect
to expand it.
Yeah, to expand in a more fluid way, flexible way the vocabulary, and also his ability to stay in groups will improve more and more, because he's not really comfortable with noise. So voicing noise, and people are speaking around. And this is frustrating him a lot. And because of that, when he's in a room with a lot of people, he tends to stay aside.
He has got a sibling brother, hasn't he?
Yeah.
How does he interact with him, and has it changed, this interaction with brother to brother?
Yes, it changed in a way that Andreas developed so much in different abilities that his big brother is jealous.
Really?
Yes. He's always asking us parents for attention because he's really jealous. So.
Okay. Has he, the older brother, ever told you, like, Mommy, look, he's now doing it differently, look, or have you noticed that he's happy for his little brother to improve?
Yes, he's happy, he noticed the difference, and now they have fun together.
Great. When you have visited us last time, we were in a very, very, very small clinic. Now we are in a bigger place. How do you find this place?
This place is really comfortable for families. There's a really big garden, so they can stay outside, they can play outside, and the facilities are really good done. And it's really comfortable staying here. It's like staying on vacation.
Oh, really?
Yeah.
All right, you're one of those Italian speaking patients who speak English. For those who don't speak English, who speak only Italian, should they be worried of some miscommunication, of not being understood?
No, last time, so the first time here, but also now, there's an interpreter, Marco.
Yes.
And he's helping Italian families with the communication issues. He's giving advice, support, and I mean, we had no difficulties. So
it was nice to come back and see the same faces, right?
Yes.
It feels comforting, right?
Yes.
Like you came back to something which is familiar. All right, I think. Would you just one tiny little question, last one? Would you recommend stem cell therapies for other autistic kids? What kind of advice can you give to families who have similar problems like you do? Should they come and go for it and try stem cell therapy?
Yes, I would recommend it. I perfectly understand the fear of a mother, a fear of the parents, of the entire family. And I know that stem cells are an experimental treatment,
yes,
but they actually work.